Welcome everyone, and thank you for joining us for Fundamentals for a Culture of Continuous Improvement. In today's session, session 4, will be focused on utilizing tools in charts. So today's objectives are going to be to understand how to utilize a Plan, Do, Study, Act framework, learn how to utilize a run chart, and then understand how to utilize a Pareto chart. So why does all of this matter? So we know that data can lead to information which can help inform decisions. And you don't need to be an analyst to use and understand data. Some of you might have access to an analyst team. I know we do at Superior Health, which can definitely be really beneficial. But sometimes if you just have a smaller project that you just want to keep track of on your own, there are some simple ways to do that. So that's what we're going to get into today, some things that you might be able to take on your own without incorporating some heavy analytics. So the first thing we're going to look at is the Plan, Do, Study, Act framework, or PDSA. It can also be called the Plan, Do, Check Act. There are quite a few different names for it. This is something you're probably pretty familiar with. I know Barb mentioned it in an earlier presentation. You utilize this when you're testing a change. So the first step is the plan step. So you want to map out what your objectives are. What do you expect to happen and why do you expect it to happen that way? So that will be something like a hypothesis. Then you want to make your plan. And in the process of making that plan, you want to ask these questions. Who will be involved? Who do you need to loop into this PDSA framework to make sure that they're all informed about what's going to happen? What change are you making? As you're writing that down, think back to who will be involved. Maybe there's a few extra people that you need to loop in after you've looked at that change. When will you start and end? A lot of times, which I'll get into, this is a pilot. So when is that pilot going to kick off? And when are you going to end it to start looking at the data? And then where will the change be made? Again, this is something that will help you identify who will be involved. Maybe you're just going to start this pilot in a certain department or with a certain nurse or something like that. And that will help you identify maybe some extra people that need to be involved. And then what data will you need to collect? Because again, we know that data will lead to that information which helps us make a final decision. So step 2 is the do step. Now it's time to test your plan. This is, like I mentioned, similar to a pilot. You want to remember to document barriers throughout this pilot and any other unexpected problems so that you can kind of modify things so you don't face those barriers and unexpected problems again. And then during this do step, you're collecting that data and you're going to start to analyze it. Step 3 is the study phase, and this is the time to analyze and study the results. You want to look back at that hypothesis or prediction that you made during the planning stage and compare them to what actually happened. What does this data look like? Is it similar to what you expected? And then reflect on what was learned. And finally, summarize your results. Step 4 is this act phase. So you're going to take what you learned from the test and make modifications. And you have 2 options from there. Maybe you're going to plan for the next test. Maybe you want to modify some things and see if that works better, or implement those changes that you made because they worked really well. We identified a few barriers that we can tweak a little bit so that they run smoothly next time. And you're going to implement it on a larger scale rather than just focusing on a single department or a single nurse. You're going to move it onto the bigger picture. So that model of improvement is shown right over here on the right. It looks at what are we trying to accomplish. This is those questions that we kind of asked in that plan stage. How will we know that a change is an improvement, and what change can we make that will result in an improvement? And this infographic kind of shows you that Plan, Do, Study, Act cycle can go on and on until you kind of perfect things. So using a PDSA in what you're doing right now. So we want to always kind of have 2 different stages throughout this presentation. I'm going to explain some ways you might be able to use this right now in COVID-19, but also ways so that we know someday this is going to be over and what will we be focused on then. And I know that COVID-19 is taking up so much of everyone's energy right now. So I want to give some meaningful things to right now, but also as we're looking to the future, what can we also utilize it for? So maybe based on what happened this year, you want to improve your personal protective equipment training. Usually organizations have a staff competency day or week where they get all of their staff members' competencies completed. And you want to incorporate a different training based on what happened this year. Maybe there's some new things out there that will really be focused on some of the things that happened this year. You want to just try that out with a subset of your staff and see how they liked it and if it fit better than what you've used in the past. And if they really liked it, maybe you're going to give that to all of your staff moving forward. Or another idea, utilizing a new SNF to dialysis center transfer form, which includes COVID status. Maybe this wasn't something that had a place on your current transfer forms, and you're just going to start working with one dialysis center and then move along to others once you've kind of got it perfected and it includes all of the information needed. For some non-COVID-19 focused ideas, maybe you're going to start a self-measured blood pressure program in your clinic. You're going to start with a subset of patients, and if that's working really well, move it on to the whole patient population. Or similar to that SNF to dialysis center transfer form, a new SNF to ED transfer form. So just some ideas of ways that you can utilize a PDSA right now or in the future. The next thing we'll talk about are run charts. So run charts tell us, has our change resulted in an improvement, and did I hold the improvement? So data within run charts is kept in time order so you can identify a flow. These are especially helpful after you've made a change. You can notate the area and the time that the change was made on the run chart and see how that information changes from the information before the change. Sometimes run charts will speak for themselves. You'll see this change and everything is increasing after that. Not always going to be the case. So there are some tools or rules that I'm going to go into in the next several slides that will tell you when you don't have that obvious change, what you can look for to see if there are some trends that can lead to decisions. So what are some ideas for COVID-19 focused projects? Again, you could utilize a PDSA, and this is the way you're looking at your data. So maybe you're going to track the daily number of COVID positive patients in your facility after a new stay-at-home order. This will help you see, is that stay-at-home kind of working in your area? For a non-COVID-19 focused idea, tracking the average length of stay by month after a new discharge process is put in place. So just again, just a couple ideas to help your mindset get in the right area. So as I mentioned, there are some rules to a run chart, which I'll go over. The first one is a shift. This is where you have 6 or more consecutive points, either all above or all below the center line, and points on the center line are not counted. Those points, although they do fall on the center line, don't make or break a shift. So before I get to all of those rules, I do just want to explain what this run chart looks like. So we see here that we have the sequence of the data across the bottom, or the x-axis, and then on the y-axis, we have the measure or characteristic. And this is the information we really care about, because at the bottom we can have time, and at the side is kind of the frequency of something happening. And you'll notice that this is the center line that I referenced right there across. And in order to place that line, you can use the mean or median of the data points. You don't want to start with the center line right off the bat because you won't have really a mean or median until you get around 12 points. So once you have 12 points, you'll find the mean or median. It's kind of up to you. A lot of places might recommend that median. So once you find 12 points, maybe you're going to go with the median. You're going to place that center line, and then you'll reevaluate that center line. So once you hit 20 or 30 data points, your mean and median are going to change. So you'll want to reevaluate where you're placing that center line. So let's look at these rules again. We can see here, this is 6, 1, 2, 3, 4, 5, 6, or more consecutive points all above the center line. So this is a shift. Here is a shift all below the center line. Now this one doesn't have a great example of a point on the center line not being counted, but let's just say that this middle area was all below the center line, except for this point will remain on the center line, and then we had another one below the center line. As long as there were 6, even with this one being somewhere in the middle, still on the center line, 6 all below the center line, that would still be considered a shift. So you will know that you have a statistically significant evidence of change if you see one of these shifts. So rule 2 is a trend. And this is where you have 5 or more consecutive points all going up, or 5 or more consecutive points all going down. Now, the little caveat in this one is if you have 2 or more points that are the same value, you only count the first point. And if you have like values, they do not make or break a trend. So again, we can see that here in this first circled area, 1, 2, 3, 4, these 2 are the same. So we would skip the second one, 5, 6, 7. So that does fall under this 5 or more consecutive points all going up. There's no need to worry about how much change there is between points, just that they continue to go up or down. And again, this does signify a statistically significant change has been made. The next rule gets a little bit more in depth. So this is rule 3, too many or too few runs. So a run is a series of points in a row on one side of the center line. And this is really going to be helpful when you don't have very much data to start with. Too few or too many runs signal a non-random pattern of change. So we always want to be watching out for that. Some points that fall right on the median will make it difficult to determine which run they are in. And then finally, data must cross the center line in order to identify that a new run is started. An easy way to count the number of times the data crosses the center line, you just want to look at that, and I will get into that on the next slide, and add 1. So this slide includes the step, but also a picture of what I just explained. So what you want to do to start out is count the number of data points that do not fall in the center line. So on this one, we have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. We have 10 number of data points that do not fall in the center line. This one's pretty close, but it's not quite there. So we definitely still count that. If it were right on the center line, we would not count it and we would just have 9. Then on the next slide, I'll show a table that you'll use to determine if there are too many or too few runs on a chart. Too few runs demonstrates a non-random signal, which can be improvement or degradation. So that shows us something that we can utilize. Too many runs signal non-randomness, which generally and often may be due to organization or stratification of data. So you might need to switch some things up because something's not showing up quite right on this chart. So this is that chart that I just referenced. We can see that we had 10 points, and we look for the 10 on this chart, and then we'll want to see, did we have between 3 and 9 runs? So if we go back, and remember on the last slide, I explained how to count the runs. You want to look for how many times does the data cross the center line. And on this one, it just crosses it 1 time. But from what I explained, in order to count the number of runs, you want to find the number of times it crosses the center line and then add 1, because we have this run and we have this run. So that's just a really easy way that once you have a lot more runs on one chart, you don't have to try to break it all up. You can just count the number of times that it crosses the center line and then add 1 more to that. So this one would have 2 total runs. When we go on to this chart, we see that there were 10 data points, and between 3 and 9 runs is expected, and we had fewer than that. So what that tells us is too few runs demonstrates a non-random signal, which can be improvement or degradation, which in this case, we're seeing quite a bit of increase. So that would likely mean improvement. So as I mentioned, this chart is available online. They're all going to kind of look the same, where it shows you the number of points. That's what you counted, data points, and then runs, which is crossing the center line plus 1. Anything between the number of lower runs or upper number of runs shows a usual amount of variation. Just a signal exists when the number of runs is outside of that range. The last rule is the astronomical data point. This is obviously different from other points. There's universal agreement that it's unusual. Now we know that every data set has a high and a low point, but not all high and low points are astronomical. So this rule is going to be something that's really helpful in identifying something unusual happening. If a chart looks at numbers of vaccines given per day, and then you see on day 13 right here, that number went way down, you would want to look into why that was. Maybe you were running low and weren't getting a new shipment in until that evening, so things kind of slowed down. So that's what that astronomical data point can kind of tell you. So using those rules, if one or more of those rules are met, that may be evidence of improvement or degradation. And these are signals of an effective change. So run charts are something that you can utilize within that PDSA cycle. You can reference these rules to see if you have any of those changes, and they're things that you can do without having a heavy analyst background. The last one I'm going to go into is the Pareto chart. So a Pareto chart helps you identify the areas that will matter most to and make the biggest impact on your organization. So what they look at is, out of several variables, which is the most important to focus on. Now these are similar to a bar chart where each individual variable is represented by a bar, and they are arranged in order of occurrence from highest to lowest. Each bar represents a different problem or variable, and when your data can be arranged into categories, Pareto charts are a great option. So here are a couple ideas that you might be able to utilize, and we'll look into the first one a little bit more on the next slide. Identifying the most common types of medication errors. Maybe you're looking at ways to really reduce medication errors, and you want to start out with the big one. What are our staff members kind of having these errors with? This is a Pareto chart is a good way to identify the most. And then another idea, surveying your staff to find the best ways to support them during COVID-19, or surveying your staff now that we're in this vaccine season, surveying your staff to find out what their hesitancies are with getting a vaccine, and maybe doing your education more tailored to that. So here's an example of a Pareto chart, and there's just one rule with the Pareto chart, and that's that 80% of the effect comes from 20% of the cause. So we see here that we have the vital few and the trivial many. So 80% of the most important things are found in these 4 items, whereas the rest of these items account for 20% of your total population. So this will tell you that you want to focus on doses missed, wrong time, wrong drug, and overdose on your education about medication errors. So that's kind of the use of a Pareto chart. So now what? You'll want to work with your team to decide what quality improvement projects you want to start. You can start off by using that PDSA framework to get started. Determine if a run chart or a Pareto chart might be able to be used to track your data. And then bring what you plan or what you learn back to a future ECHO session and present it as a case study to gain feedback and recommendations. With that, do we have any questions?
Elena, what was the green line on the Pareto chart? Was that still the mean or the median?
So this green line represents that 80%, that cutoff. So we have the frequency of 80. So that just is that 80%. Once you reach that 80%, it kind of shows us the vital few. And that's how we got to this 100 of the percent of answers, right? So once we got to that 80% mark,
and I'm not seeing any questions in chat other than a lot of comments saying nice presentation, an excellent presentation, very well done. So that's nice to hear. It was very helpful.
Yeah, thanks everyone. Next time we'll do a few other tools and charts again that you can use without having a bunch of data software, things like that. There might be some things that you'll learn from some of these tools and charts that if you do have access to an analyst, you can bring to them and say, this is kind of concerning me, or I'm seeing that we're having this degradation, when I expected an increase, bring that to them, and then they can kind of help you identify some other ways to look at the data or some other things to test and hopefully see that change that you're looking for. So with that, I will stop sharing and we can move on, but feel free to email me or ask any questions if you have any.
Elena, it's Kim again. No, I don't remember what I was going to ask after you said move on, so I'll stick it in the chat box.
Yeah, no, I think I did see one that you said, is this the same as a control chart? So
Yeah.
the run chart is pretty similar to a control chart, just a control chart does have a little bit more statistics involved in it. So I didn't include that in this because that would be something that you might need a little bit extra, either analysis background or some programming to be able to assist with that. So that would be taking a run chart kind of to the next level.
So the run chart itself just had individual points of data. They weren't averages or a 12-month average. It was just an individual point in time each time.
Yeah, but I think you could definitely do like a month by month average to look at how the data is changing as well. Just kind of depends on your frequency that you choose.
Okay.
But definitely a control chart gets a little bit more data, like with your thinking with your data brain rather than just kind of being able to track these things on your own. Not that these are not data focused, they're just not as in depth as maybe what that control chart would ask for you to analyze.
All right. Okay. Well, and if anyone thinks of any other questions, please put them in the chat, or, you know, if you think of something after, you can always view the recording after we send it out. And if you think of anything in between time, please, you know, email Elena and I, and we'd be happy to respond to you at that time. If you're okay with it, we'd also like to then bring that question back to the larger group too, so we can let other people know what you might be thinking. And everybody always likes to have different answers for questions, so we're open to that as well. All right, so moving along, we're very excited today. We did have a case presentation from one of our participants submitted this week. Natalie Mathewson, I believe I said it correctly. Good. Is from Central Minnesota Council on Aging, and she will present she has a question for everyone, and she has a brief presentation. Let's see, Elena, are you able to share that? It went out to everyone just before this presentation, but we always share it afterwards as well. So the framework for this is Natalie will present, she will ask her questions, and then I will ask the group if they have any clarifying questions, and then after that we'll go through recommendations. So Natalie, if you'd like to start.
Okay, thank you. Hopefully you can hear me. Okay, I had a little glitch getting in today, so thank you. Yeah, so last week when we had the meeting, we had a short discussion about how do we bring families back in and support systems back into the facilities. It made me think of we're going to be working on bringing our staff back in because in March of this year, we have the senior linkage line as part of our staff with our agency. And the state board on aging said, you know, no in person, no anything. So we really quickly had to take a majority of our staff that were all housed in our offices and everyone working from home. So we only have a very few people working in the office right now. So and you can probably bring, yeah, okay. So basically I just wanted to propose this and kind of ask some questions to the group. Really what I'm going to be looking at is right now we have been instructed to work virtually through June of 2021. I don't know if those dates are going to move. We did do a survey earlier this year to get people's thoughts on if we started to bring people back into the office and their comfort level. So basically, the vision, or what I'm looking for is, we will successfully bring majority of the staff back to work back in the agency offices. We have a primary office, main office in one of the cities in our 14 counties that we serve. And then we have several satellite offices within our 14 counties. And as I mentioned in March, we basically have all been working from home, started working from home. This is temporary, as the vision of the leadership team is to return back and bringing the majority of the staff working back in the office when it's safe. So the people that are going to be involved with this will be our leadership team, which is our executive director, our finance manager, who is also our IT person. We're a small agency and she does HR too. And so myself, as well as our contracts manager and our senior linkage supervisor. And so we haven't really talked much about it. Our executive director has told our staff in staff meetings that we will be coming back, but just looking ahead, thinking ahead when and how that's going to be. So what we'll be doing is, and we're currently doing that, we'll be following the Minnesota State Department of Health and the governor's recommendations, and we will have a plan to be set for transitioning staff working back in the office. For example, if the recommendation is to have a percentage of capacity, we'll determine a schedule of the number of staff to be in the office at a given time. We're kind of currently doing that right now. The positive thing, which we're very fortunate, is no one shares an office with our agency. We all have our own offices. So that's kind of unique. I know a lot of agencies have cubicles and things like that. So, and it's also, so right now, we haven't had to worry about it, but if anyone who generally isn't in the office is planning on coming in, we usually let the admin assistant know that we're planning on being there. So there isn't too many people. I don't see it as a huge issue because our main office is pretty large and it's spread out on like half of a third floor. So, but it's just those smaller meeting spaces. And then also it's just going to depend on who's willing and able to receive the vaccination. Obviously right now there isn't going to be a requirement for that, as well as safety, because if there might be different things happening. So maybe we might be able to bring back into work, but we have a number of staff that are still have children that might, who knows, they might still be virtual learning. So that makes it tricky. So that ability. And the other thing is within several weeks time this last year, our agency ordered, a lot of us had laptops, but not everybody. So everyone has laptops that were assigned to them. So it's kind of coordinating that, like, are we going to let people continue to have their laptops for a period of time who come into the office? You can scroll down a little bit, Lena. I think when we're looking at this, some of this stuff was just NA at this point, but one of the middle questions is, we do anticipate that we're going to get some pushback from staff that want to remain working remotely. Some of, not everybody, we just have some people who like a combination of, other people have really had a hard time working from home because they like to be around other staff and other people. But we do anticipate that we're going to get some pushback. So I guess my questions to the group is, have you experienced this type of staff transition, like not necessarily now during the pandemic, but now or in the past? Has your agency discussed plans to transition staff after it is safe for all to be in the office? And what strategies did or will you use to make this transition happen?
Great. Thanks, Natalie. That was just a wonderful presentation. And I think very timely. So just to sort of summarize, the presentation was really focused on developing a process for staff who have currently been working remotely and then planning for them to return back to the office. This had not been the history of this organization. You had all been working either in your main branch or at a satellite office, but due to the pandemic, the organization did have people start working remotely from home, but the leadership's vision is to have everyone return to an office-based work environment Is that sort of a pretty accurate summary of
Yes,
the case?
very good.
Okay, great.
Thank you.
So at this point in the case presentation, we like to have people ask clarifying questions to Natalie, something as she was presenting the information that you want to make sure you understand accurately, or maybe have her expand on a little bit. This isn't the time that we're asking for recommendations. We just want to see if you can get clarification on anything that she's presented today. Not seeing anything in the chat right now. I mean, the one thing I might ask, is there something in particular about your organization that lends itself to needing to be on site? Is there something about it?
I think part of it is just the continued culture of it, just the teamwork of it. I don't think that there's something that requires, we don't have people come in to the office regularly. A lot of the work is either over the phone or out in the community. I think it's just the some of the leadership. It's just historically they have felt that it's to have a really strong team. It's good to have people closer proximity just to bounce things off of each other and things like that. So yeah, I did see a question in there. Did you say COVID vaccine would be? No, I don't believe that we will or can require that for staff at this point, the vaccine. I think what I'm hearing from some of the leadership that have been there for a while is they're concerned if we continue the remote process that it's going to lose some of that culture that the agency has.
Hi, Natalie. This is Janelle. I have a couple of questions for you because, you know, I'm sure most of our organizations that have been able to work remote face the same thing. And I've been kind of curious, like, what's it going to look like in the future? Because there are so many advantages to working remotely, although like we really miss our coworkers like big time. Do you think your leadership would be open to hearing staff opinion, especially since you think there's going to be pushback, and whether they would be interested in a modified in-person approach? You know, so say certain days are office days and other days could be remote days.
I think that was something that I could take back to the leadership team to see if it's something that they're willing to be open to hear. I had actually mentioned, because not realizing how long we would be working remotely, we did a survey of the staff earlier this year. I had mentioned maybe we need to do another one as we get closer to get some of that information too.
Natalie, this is Darlene Nadine. Did you say that everybody has their own office?
Yes.
Okay. I guess that would make a difference as to how much you could use the culture of the office place as a reason for people to be back in the office. And then I was going to ask the same thing as Janelle. I wondered if they would be open to some modifications so that you could perhaps continue to develop, you know, an atmosphere or a culture of sharing along with, you know, the remote work, which can be for some people very productive and not so much for others.
Yeah, thank you. Past company I worked for, we developed a telework policy, and it wasn't something for everybody. So definitely there was some piloting of it and things like that. And some people just wanted to and needed to work in the office most of the time, while others did very well. So yeah, good suggestion. Thank you.
And it looks like we've sort of because Natalie did such a lovely job with her presentation, it doesn't sound like anybody had any specific clarifying questions per se, but it sounds like we're moving into the sort of thought process of recommendations. Oh, but there are some things in chat here. So, and how are the sites adjusting from their COVID-19 screening tools for post-vaccine, perhaps future session, especially for sites that are not mandating the vaccine? I would assume that unvaccinated may present ongoing community-based risks.
It'll be interesting to see what happens because we do have staff that meet with people in person in the community. So I don't know if that's going to be a high recommendation. I think it's still early in the process. I just know statewide and nationally, it's not something that's been mandated at this point, probably because there isn't, enough vaccines for everybody. But yeah, definitely something to think about, especially we do have staff that meet with people in the community and in their homes. So, yeah.
I think also overall, in the beginning of next year, we're starting our COVID-19 open sharing calls, and we're thinking that one of our first calls will probably be looking at that. I know each state is rolling some things out a little differently with education and such, but it's a huge endeavor, and things keep changing a bit all the time with that. So we'll be learning more about that as well, but it's kind of interesting to see firsthand how your agency is looking at that, even as a community organization at this point.
Yeah. And I see Bernadette's comment in chat. Thank you, Bernadette. Yeah. She had said that one agency polled their employees for preferences along with reasons for their preference. We did something similar to that when we did the survey, but I think that might be helpful too. Is, I think that if there's staff or departments that feel like that they could do more work from home, they might have to kind of plead their case maybe or something. So, and why the preference is. So, and like you had said, maybe finding a way, if there's this happy medium of making sure that we still have that culture and that support, not being all in the same office.
And this is Janelle again, and I would think you'd want to somehow ensure the safety of the in-office environment. So even though everybody has their own office, you're going to be meeting probably in conference rooms, and so you'd want to have some, whether you keep masking until it's eradicated, or the distancing and all that type of thing.
Yeah, thank you. Right now, we do have that rule. The building that we're in, actually, we leased from a bigger corporation, and we have to be masked walking in. We have to get our temperature taken when we go in the building. Anytime we're outside of our office, we have to be masked. And they basically, even though we have like a break room, no one is allowed really or asked to not congregate in there right now. So that's a good point, maybe continuing to kind of through that transition until we know, even if more people in the office just could have the congregate areas.
I just want to go back to one of your questions that you had, Natalie. Just wondering, has anyone else experienced this type of staff transition, or are you getting ready to plan for something similar or getting in that thought process? I know we're probably still a couple months away, like you mentioned, about before we're bringing all of our staff back in, but who else is going through that or thinking about that? Is there anybody here? Can either put it in the chat or unmute yourself.
Hi, we have experienced that. I think a lot of the healthcare agencies here, we're in Michigan, so I should say that. So we initially all went to work remotely, and then we started to bring back individuals, management, data people, admissions in So for example, if we had 3 admission people, 1 would be there each day. So they wouldn't all come back at the same time. Same with management. Because we're cubicles, basically there's 3 large rooms. So, you know, there were no individual offices. And then we, of course, were asked to work remotely again. So everybody's back to remote. For us with the cubicles, a huge consideration was safety and wearing masks and not having too many people in the building at the same time. And I imagine it'll be similar when we start coming back again. Many of us actually work out in the community, so we're not in the office very much anyway. And what we do is we have regular staff meetings right now by Zoom, but normally we all get together and, you know, have coffee and goodies before so we can visit and talk and, develop our relationships. So I'm looking forward to that day going back, but basically, since everybody is now able to have, they have their own laptops and things are working rather smoothly, I think safety will be the #1 consideration for our return to the office. And then, who's really needs to be there. Again, like Natalie, we don't have people coming into the office very often. We mostly go out and meet with them. So it's not critical that we have office space available for the public and for the people that we're working with. That's just kind of how we did it. Don't know how we'll do it next time, but.
Yeah. Well, I think we all have a good plan in place to be ready, prepared if we need to go back, right, for things and have that ability. I know before there was maybe a few people that work from home, some, but not everybody. But I think now if there's like an issue that comes up, even if it's on an individual basis, that might be something that could be offered, for someone to,
Yeah, it certainly seems to me that one thing people have learned from all of this is flexibility, and that things can be done in a new and different way, and business can still continue. You can support your staff. It did make me think of a few of the other previous presentations where, if leadership feels strongly about this and thinks that in-person really does create more camaraderie and more team environment, that, creativity spurs from this. Again, the importance of them walking the walk, talking the talk, really helping people understand why is this important to them? Why is this important to the staff? And then listening to the staff about their concerns and truly asking for their input as to if you're concerned about coming back, what would we need to do to help you feel safe? Asking, engaging everybody, doing that sort of lean process from, the staff up to leadership and asking how that all can be incorporated. I think sometimes when people feel truly listened to, they feel more safe. And there, I think I liked Arlene's I really like that suggestion, starting a meeting even earlier or having, the meeting starts at 10, but if you want to join at 9:45 and have the time for just coffee and socialization, on Zoom, I did a few, we had some collaboratives where I had like open time in the beginning of the meeting. We used to have open time at the end of our collaborative meetings, but to start off the meeting with some informal networking and things like that could maybe be an adaptive way of dealing with that too for people who still, don't want to come in, or if working with that at least.
Good idea.
I have another question. Do you already, for those staff members that are already in the office, do you kind of have a policy in place for them, or some kind of policy during COVID-19 for the expectations that you are in the office? I know you mentioned that mask wearing and distancing. Is there a physical policy for that?
I don't know if there is yet, but I think we're working on those. We had to put it together very well. Actually, yes, there is. During this process, we did come up with a policy for them. I'd have to see, because a lot of it was just through email. There's so much things happening quickly. It's like, here's what we got to do. And we were really following the guidance of the health department and the governor. And so those are things. So, but we're kind of going through a lot of our policies and procedures right now and reviewing them just to kind of make sure we've incorporated a lot of those things, and it's time to review them anyway. So, but thank you. I'm going to ask. So
Yeah, I
it's
know.
good to have it in.
So
Yeah.
our organization in Michigan, we're MPro, and we have not gone back into the office. There's a few select people similar to what you're going through that are in the office to just maintain normal operation. But I know we have like a select team that's been looking at the governor's orders and our health department orders that are constantly changing, which makes it difficult to kind of keep your policy up to date. But I would definitely suggest before you kind of start having those conversations with your staff about coming back in, having a policy in place that you can share with them to say, this is going to be what the expectations are. We've been planning what the safety will look like. I think that will be really beneficial, that they can see that you've thought this process out and here it is on paper. So that would be one of my recommendations.
No, thank you. I appreciate that. I know that we had some things come out earlier, but I don't know if it's been made official policy. So I will check into that.
Well, it looks like we're coming up on about 4 minutes left. Anyone else have any recommendations or suggestions for Natalie? This has been a great discussion.
Hi, this is Andrea Hayden from North Memorial Health. Myself and several of my colleagues are from North Memorial are on the call, and I just want to share at a very high level. We have a couple of different committees and approaches that are being taken. One is setting up guidelines for how to be safe at work. All of the things that you mentioned may already be developed in policies that you have, Natalie. So that's one piece of work that's going on. And then there's another committee that is called our Remote Workforce Work Group, looking at what we do with our team members who are remote and what is that transition possibly going to look like. And we're in some early stages of considerations and conversations about what the future may look like. But one of the great things that we have is periodic updates that remind us about the safer at work rules that we have, and also give us an update on where we are on the remote workforce as we are moving forward. So everybody stays in the know and knows how long we know we will be remote, and that we're in a transition period in considering what the future is going to be throughout 2021.
Thank you. I appreciate that. And glad that you guys are continuing to keep staff up to date and letting them know this is where we're at in the process. Yeah.
Oh my goodness, this hour certainly can go very quickly. This has just been a wonderful discussion. Natalie, I hope you're coming away with some thoughts and suggestions, and I hope some other people learned some things. We really appreciate the input from everybody. This is just wonderful information, and again, it's so timely. Just wanted to thank Elena again today. That was a lot of content, but done very nicely, and I think very beneficial for people trying to look at data when you're doing quality improvement. Natalie, your case presentation was wonderful and very timely. And so we appreciate everybody's participation with your questions and suggestions for Natalie today. And again, wonderful example of what a case presentation is and the kind of feedback you can get from everyone. So again, we're always looking for those. If you have any question or anything about quality improvement at your organization, we're happy to take that case presentation and offer it up to the group. So also, we will always follow up with the recording from today's presentation, the slides, and any outcomes from that through email for everyone. We just want to remind everybody that we will be skipping next week, but our session number 5 will continue on January 5th, and that will be 10 Central Time, 11 Eastern Time. If you have any issues with the meeting invite or anything, again, please email Elena or I, and I'm blink@mpro.org, and Elena's esmith@mpro.org. I think we even found, Kim, the answer to your question about the global echo. I think that is separate from the Echo Institute. That is the Echo Institute is putting on another echo. So there are a lot of echoes going on out there. It's a wonderful format, so I do understand, but that is separate from the one that I talked about regarding SNFs and Andrea Boucher and the one that she's coordinating. We do hope everybody has a safe and happy holiday season over the next 2 weeks. We're very excited to continue with our sessions, the first of the year on January 5th. And take care, everyone, and take care of yourselves and take care of your family and everyone that you care for. All right, thanks.